Good day to our viewers, and my name is Sunil Gokavi. I'm a surgeon by training, having done my undergraduate and postgraduate training from the Christian Medical College at Vellore way back in the 80s and 90s. I have since been working in rural parts of northern India in an organization called the Emmanuel Hospital Association that basically focuses on the rural, poor and marginalized. I just, as a surgeon, have come across many cases, obviously, of patients who come to our clinic with abdominal pain. And I'm sure that all of us at some time or the other have had this. And some of the major difficulties that patients have experienced is trying to figure out whether this needs just medicine, whether it can be ignored, or whether there has to be a surgical intervention. The most common feature as far as abdominal pain is concerned is a kind of a burning mainly in the upper part of the abdomen, and this is often referred to as gas. But we also need to be aware that everything cannot just be treated by medicines alone. Some of them are actual surgical cases. And what is commonly termed as gas could very well be an ulcer that needs medical treatment. It could be something that an ulcer can become a hole or a perforation, as we call it, which needs an emergent surgical operation. But more commonly, one of the main causes for this kind of a discomfort in the upper abdomen is related with the gallbladder. And it has to do with stones, which is quite commonly known. And if symptomatic with this time and time again, it sometimes is associated with a lot of belching and flatulence. This can be treated surgically through an operation that now is a keyhole surgery called laparoscopic surgery. Now, apart from this, there are other sinister causes of upper abdominal pain, and one should never rule out, especially when one is closer in the range of the 40s and 50s, that one needs to think in terms of the possibility of heart diseases or cardiac events that could also mimic this kind of abdominal pain. There are other things that cause abdominal pain, obviously, and some of it can just be things like constipation, it can be worms, it can be food poisoning, and it could be any other things that may need intervention of different sorts. But if abdominal pain is associated with the bloating of the abdomen and symptoms of vomiting, then it is good to consult a surgeon just to ensure that there is no symptom or sign that suggests an obstruction or a blockage of the intestinal passage, which may require some kind of surgical intervention. So these are just some snapshots of what could be a cause of abdominal pain. Just to remember, it can be ignored at some points, but if it persists, it needs to be seen by a doctor and sometimes by a surgeon as well. So keep these in mind when you have any symptoms that may cause you concern. Thank you.